Good day, my dear colleagues. This is the RNA series number 49. I am Dr.K Gireesh, physician, neurophysician, and neurosurgeon. In this series, RNA series 49 is nothing but random questions in neurology and neurosurgery with answers by Dr. Gireesh. This is to benefit the practitioners of neuroscience and the medical field for a lifelong learning and also for public awareness. In this series, the question that I'm addressing, what is or are the features of dementia pugilistica, punch-drunk syndrome? Well, the definition of dementia pugilistica is a historical term used to describe a neurodegenerative condition seen in boxers due to repetitive head trauma. Today, it is recognized under the broader entity of chronic traumatic encephalopathy, CTE. What is this pugilistica? Pugilist is a boxer, meaning boxer. It is first described in 1928 by the pathologist Harrison Martland as punch-drunk syndrome. The pathophysiology one has to look into means it repeated subconcussive or concussive blows produces axonal injury and neuroinflammation, which leads to abnormal accumulation of hyperphosphorylated protein, tau protein, which leads to neurodegeneration, especially the frontal and the temporal lobes. The characteristic finding we see in pathology will be the perivascular tau deposition, sulcal depth involvement, the frontal and temporal lobe atrophy, and cavum septum pellucidum. It's very common in boxers. Let's see the clinical features. The early stage, irritability, mood swings, impulsivity, depression. The cognitive stage, memory impairment, executive dysfunction, and attention deficits. The late stage, you get dementia, Parkinsonian features, and dysarthria, gait instability. Well, the differential diagnosis of dementia pugilistica. They are Alzheimer's disease, frontotemporal dementia, Parkinson's disease, and substance abuse-related cognitive decline. But the history of repetitive head trauma is very classical of a punch-drunk syndrome or dementia pugilistica. Currently, the definitive diagnosis is only seeing the brain as such, only in postmortem or neuropathology finding. But research tools are there which, you can pick up certain things like tau PET imaging, can pick up the tau abnormal protein accumulation. MRI shows a frontal lobe atrophy, which is only an indirect sign. Neuropsychological testing and CSF biomarkers are under study. The risk groups of who develop these dementia pugilistica are the boxers, the American football players, wrestlers, military personnel, especially following blast injury. No curative treatments, only symptomatic. Antidepressants can be food for mood alterations. Cholinesterase inhibitors on a trial basis have been tried. Parkinsonian medications if needed. Cognitive rehabilitation can be done, and strict avoidance of further head trauma. The preventive strategies are in fact very important. The changes in sports are very important. Rule changes in sports, protective headgear to be placed, then concussion protocols to be in place, education at youth level have got to be done. Well, the number of publications on this, notable being the Martland's publication of as early as 1920 in the Journal of American Medical Association, and then in Lancet Neurology 2011 as Stern R. et al. In the Chronic Traumatic Encephalopathy clinical presentation, a very good article. Mackey et al. Neuropathology of Chronic Traumatic Encephalopathy. That is the Journal of Neuropathology and Experimental Neurology 2009. All these references, in fact, give very detailed about this one particular condition, and that is indeed the features of dementia pugilistica. Thank you very much.